Greetings. I'm Dr. Lippy Roy, and welcome to Movie Monday. I'm a big fan of the Academy Awards, which just aired last night, and it had a little bit of drama near the end. Ever since I was a little girl, I found the movie-going experience to be a real special treat. Taking a couple of hours to watch an action adventure or psychological thriller or a romantic comedy on the big screen and just suspend disbelief was really a luxury back then. But now I actually think of the movie-going experience as quite therapeutic, either watching at the theaters or streaming at home. Taking time out of our busy schedules to enjoy a movie can actually be a really good form of self-care. In today's show, I will discuss a few of the medical and mental health themes in this year's Oscar-nominated films. Please note, this show will contain spoilers. The first theme is substance use. As a doctor who specializes in addiction medicine, I feel that Hollywood still hasn't quite mastered the art of accurate and non stigmatizing portrayals of people experiencing substance use disorders or drug and alcohol addiction. But it's slowly getting better. In the film The Eyes of Tammy Faye, the meteoric rise and devastating fall of the title character, brilliantly played by Jessica Chastain, is associated with years of loneliness, sadness, and marital turmoil. She self-medicates her pain and trauma with the benzodiazepine Ativan, also known as lorazepam, which is highly addictive. In the film, Tammy Faye is seen taking a pill every time she witnesses an anxiety-provoking event, such as her husband, Jim Baker's indiscretions. Without any other social, medical, or therapeutic supports, not surprisingly, Tammy develops an addiction to benzos. Her thinking and behavior become impaired, and eventually she loses consciousness on air. In the film Nightmare Alley, alcohol laced with opium is used to exploit vulnerable men who then become the geek, chained, caged, and treated like savages. They can't leave because they become addicted to the opium and will do anything to avoid highly uncomfortable withdrawal symptoms, including nausea, vomiting, diarrhea, sweats, body aches, anxiety, and suicidal thoughts. People who use drugs and or develop a substance use disorder deserve respect and deserve to be treated with dignity and should receive access to evidence-based treatment and care. The second health theme is early inner turmoil or childhood trauma. In King Richard, several characters experience traumatizing events, either directly or indirectly. Richard Williams, masterfully portrayed by Will Smith, shares with his daughters several childhood stories of verbal and physical abuse while growing up in the racially segregated Deep South. His lack of formal education is also a source of insecurity, which in large part motivates him to drive his daughters to excel academically and athletically. His daughters, in turn, are traumatized by witnessing a local gang's assault on their father. In the film Belfast, 9-year-old Buddy's joyful childhood quickly falls apart in 1960s Northern Ireland. Sectarian conflict between the Irish Catholics and Protestants leads to violence and neighborhood curfews. He is coerced, Buddy, the 9-year-old boy, is coerced into stealing chocolates and detergent and then berated by his mother. Buddy also suffers the loss of his beloved grandfather, with whom he has a loving relationship. By the end of the film, the granddad, played in heartwarming fashion by actor Kieran Hines, succumbs presumably to a coal miner's chronic illness like lung cancer, COPD, silicosis, or some other interstitial lung disease. In both King Richard and Belfast, the young characters have a good chance of doing well because they have a lot of supports: family, relatives, neighbors, coaches. Strong, trusting, and supportive connections are just as powerful, if not more, than any medicines. The third health theme is the power of science. The film Don't Look Up is a superb satire of political, government, celebrity, and media indifference to the climate crisis, specifically, but to science more broadly. This movie strongly resonated with me. As a doctor and public health advocate who spoke about COVID related health issues on live television as an MSNBC and NBC News medical contributor and commentator almost every day from the start of the pandemic, and who worked as a medical director for COVID isolation and quarantine sites, I was disappointed and frustrated by the lack of trust in scientists, researchers, and other medical experts by elected officials and the public. Misinformation spread by social media platforms also played a major role in high COVID related mortality and low vaccination rates, particularly in specific communities. A strong understanding of biology played a significant role in the film Power of the Dog, where medical student Peter applies his knowledge of anthrax, a serious infectious disease, in order to crush rancher, brutal rancher Phil Burbank, who ruthlessly taunts Peter's mother. Peter also made note of the open wound on Phil's hand, which he later soaked in bacteria infected cowhide solution. By the next day, Phil, the rancher, develops signs and symptoms of acute systemic infection and likely septic shock. Symptoms included fever, sweats, and delirium, originating likely from his gangrenous hand. Well, that's it for today. I love analyzing movies for their medical themes. And so here's your joke of the day, Hollywood version. One actress asked another actress, "How's your garlic diet going?" The other actress responded, "Well, I lost 10 pounds and all of my friends." Uh, Stay tuned for more health videos by subscribing to my YouTube channel and follow my Instagram at Health Humor Harmony Dr. Roy. Thank you, be safe, and I'll see you back here on Wednesday, 3 o'clock Eastern, when I'll be discussing women's health, National Doctors Day, and a common but rarely discussed women's medical issue. Take care.